Here at Mojo, we have been trying to focus on the issues that really matter, the issues that will affect people, the patients, and those at the front line of this battle against the coronavirus, which are our health workers. The one feedback we are getting from almost everybody in the health service sector is two things: a shortage of enough testing kits and a shortage of personal protective equipment. Now, joining us now on the program is Rajiv Nath. Rajiv Nath is the head of the Association of the Indian Medical Device Industry, a nodal agency that looks at all medical devices, and he's also the managing director of Hindustan Syringes. Welcome to the program, Mr. Rajiv Nath. Sir, I want to start by asking you to talk a little bit about this crisis that India, not just India, but the world is facing, the shortage of enough personal protective equipment. Now, I want to explain to our viewers what this is. This basically means gloves, goggles, the face mask, the hazmat suits, the protection that anyone who is treating coronavirus patients or even testing them or collecting samples from them needs. So why are we facing such an acute shortage?
Well, I would say the first starting point is because there has not been a policy in the country, possibly that for keeping a stockpile of such goods. Normally, when doctors and nurses, you've been to hospitals, they would normally be wearing their standard gowns and stuff like that. But you will rarely come across any lifetime experience for yourself when you found any doctor treating you or treating any patient with a complete overall and a complete full-fledged patient protective kit, with the goggles and the suits and everything, gloves and everything. So this has been a new experience, I would say, for India. And initially what they were looking for in terms of procurement was materials of a specification which would be matching what has been used by WHO and others in the past in Central Africa for treating patients with Ebola. And frankly, that kind of material, which uses Tyvek and that kind of specification, was simply not available in the country. And whatever little bit stocks I'm told, currently the government is supposed to be having a buffer stock of hardly about 16,000 pieces, what I'm informed. So that was not really anything. And there was no way which whatever manufacturing could take place in the country could be geared up because of lack of raw materials available to meet that specification. But subsequently, going forward, and that was not only for India, that was for the whole world, we were not prepared for it. And even the rest of the world also is seemingly not prepared for it. But yes, of course, we can find that in many cities in USA, Europe, they definitely are better equipped than what we are in India. But going forward, WHO started realizing that it may not really be an airborne kind of a virus like Ebola. It does not need to be in the same category as Ebola. And they revised their guidelines. Those guidelines were revised based on the experience being gathered in China, in Italy, and elsewhere in the middle and end of February. So once these guidelines were revised, and itself before that also, we were in touch with the government seeking specifications so that all the manufacturers could be aligned to a national specification or a national standard, and then manufacturing could be geared up accordingly. And once we would be knowing what it is, the right raw materials would be made available, number one. Number two, even if the manufacturing capacity of us manufacturers, we have 20 odd manufacturers in IMED who make such kind of, I would say, hospital wear garments. So some of them are already exporting such kind of kits to Europe and to USA. And when this crisis started in China, immediately the Americans and Europeans actually had come to India because they were sourcing stuff from India as an alternative to China. So that experience building was already taking place between the Indian manufacturers on that front.
Right.
Going forward, the issue became that the standard which had to be now complied with, or which was being asked for, there was only one testing lab in India, which is in Coimbatore. So that single source of testing has become a bottleneck initially. The test became a bottleneck. Getting the right raw material across became a bottleneck. But now the government has shortlisted nearly 9 or 11 raw material suppliers whose material has passed in that lab. And that details have been shared with us, and we've shared it with other manufacturers.
So let me come in on that. What I'm hearing you say is that first there was a confusion because WHO had a certain guidelines for what the protective equipment should be. Then it revised it, deciding that it didn't need that kind of thing. And the other problem you faced was this single nodal agency that had to, in a sense, approve or test all the PPEs. But sir, we all know now that it was only on the 19th of March that the export of personal protective equipment was actually stopped, whereas the WHO guidelines came in towards the end of February. You've also spoken to on record about how a month was lost. Can you explain how and why this 1 month delay took place?
Well, I would say that it does take time for things to. This coronavirus is such a big challenge. It's got unprecedented volumes being placed in front of us, and the demand is not known. It's unpredictable. So it's a lot of challenges over here. Now the manufacturers, they have to get the product tested. They have to make the particular product. Now the biggest challenge for the manufacturers has been to make it completely compliant to what the specification is being demanded by the Ministry of Health. Initially, we made our own specification from the two associations, and we asked WHO Geneva, WHO India, Ministry of Health, and the National Health System Resource Center to consider our specifications and to approve them or to amend them so that manufacturing could be geared up accordingly. And I think that triggered the government into coming out with a very comprehensive standard and specifications, which they released last week. Now, that's a very good document, 11-page document, a very comprehensive one, but it's a challenging one. In peacetime, one can try to achieve that in 6 to 9 months' time, but this is like a war, and we don't have 6 to 9 months' time to achieve that. Doing that achievement in a week's time is a huge, I would say, challenge over there. So that's what the government has been now trying to do. And from our side, we have been saying that maybe the garment industry needs to be roped in. At my own initiative, we've been speaking to the Apparel Export Promotion Council, their key members, large garment manufacturers in Delhi area and in South India has also reached out to them and shared with them what the guidelines are, because the basic stitching for the complete garment would not be a big issue for such a kind of people if they have the raw material and fabrics made available to them. Right. The challenge comes after that, because once the fabric and the garment has been made, the seams will allow the air to go through. Now, the seams have to be covered with a special tape, and that special tape needs to be imported from overseas. With the logistics challenge going on currently, that is being addressed by the Textile Ministry. And then there needs to be a special taping machine which needs to be made available so that this tape can be applied with a uniform pressure and have a proper sealing so no air can pass through. So that is the second bottleneck over there, which has to be addressed over there, because that kind of machine is not ready.
If these materials need to be imported, and given that everything is shut, our airports right now are shut, of course, the government could make provisions for cargo to come in. But everything I'm hearing you say, Mr. Nath, seems like we need time, and we do not have possibly that amount of time. So what do we do in the meantime? How are the manufacturers dealing with this, with the deadlines and the timelines that you have to deal with?
Well, I would say the manufacturers are continuing to make the product to whatever they have been used to making, what they have been making in the past for Europe, for USA. So they are making the product without this tape, without the seam being covered, as I would say their own company specification, what they've been making in the past to the private sector and for giving over there. But not all of them have been able to make the arrangements for the taping or for the tape system. So some of the manufacturers have now qualified and are now supplying through HLL to the government over there. And we are trying to motivate the other manufacturers also to come forward. It's a real big challenge. And we are seeking that, we're trying to make it organized that maybe the garment exporters can work as subcontractors for the experienced manufacturers and the ones who have already got qualified, so they can pass on their experience and their learnings to these garment manufacturers. Because making lakhs of pieces by the garment manufacturers per day will not be a big issue if the lockdown is removed for them and the supply chain is revived for the garment people. The challenge will only come for the taping and for the taping machine over there. And for that, a cargo plane has been organized and a date has been given to us by which time the people can collate their orders. And now on a weekly basis, there'll be cargo flights coming in from Hong Kong and from Shenzhen and Shanghai, pretty much by Air India and by other airlines. So the government is trying their best to revive the supply chain. The challenges are really huge. And I would say that everybody has to work as a team.
So the lockdown, but anything related to the medical devices would be exempt from the lockdown. But in real terms, you're suggesting that the lockdown is hitting the supply chain, even of critical medical devices. Why is that happening?
The biggest challenge has been because in most of the towns and cities, the local administration, the DC, the DM, the police officers have not really understood that medical devices are a essential product. Even though there are 4 orders issued by the Home Ministry, by the NPPA chairman, by the Secretary DOP, they've written letters directly to the chief secretaries. We as an association have written to the chief secretaries also. We have tried to empower our members and ask them to take delegations to meet the local DM, local DC. But there are some towns have been very cooperative. My own town, Faridabad, the DC and the police commissioner, for example, has been extremely cooperative over here.
Mm-hmm.
You have got towns like Noida, which are completely shut down, Daman, Diu, Baddi, Bombay area, where the police, where the manufacturer is caught between complete bureaucracy. When he goes to the SGM in Delhi, he's told that it's an essential product, it's already there in writing, so why do you need a permission? But the police officer will say, no, we cannot give to you without a written permission.
Or typical Indian situation, which makes it tough on the ground. It's a typical a unique Indian problem that you're caught between the bureaucracy and the police. But this is very serious. Have you brought it to the attention of the government? Because the government order exists on paper, but you are saying on the ground, the people who actually have to move the goods are facing problems.
Well, I would definitely applaud the government. I've been working very closely with the government, various departments in the last 2 weeks. And I must say really hats off to the cabinet secretary, the secretary DOP, and the other secretaries and the joint secretaries who were working from 7 o'clock in the morning till late at night till 1 o'clock. And on our behest, we keep on giving them names and places. And they have a complete system set up, trying to chase right till the DC level, the collector level, plead with them. We are pleading our case. They're also trying to get the message across to them and pleading the case for the country. We've got mask manufacturers who are shut down, PPE companies who are shut down. We can't afford a single day's loss. And it's completely terrible. And plus, top of it, the courier services had stopped down. So now everything is trying to be revived. The message has gone that trucks need to be kept moving. We told the government that the trucks can't move for a couple of boxes. Government was kind enough to immediately relax that and said, whatever goods are lying in transit, whatever goods are lying in the godowns, so let the trucks move even with non-essential goods. Because earlier police would beat the truck driver if he was carrying anything but a medical device or food stuff. So
has that happened? Has that happened to truck drivers who were carrying material related to medical devices that they've been beaten by the police?
Oh yes, workers have been beaten, truck drivers have been beaten. We'll see the ID card later on. First will be a stick. It's been a challenge trying to convince the workers who have been hit to come to and try to come for work again next day. Staff has been harassed, but whenever we made a complaint, I must say, like in Sonipat, the staff was harassed, taken out from the car and beaten by the police. But immediately once we brought it to the notice of the higher-ups, they took action against the errant officers over there. From our side,
but sir, all of this loses time. See, the thing is, the government may respond and it may put corrective measures in place, but it all costs time at a time when India doesn't have that kind of time. What is the gap between what you need to produce, both in PPE and kits and other devices, and what we have? What is that gap and how are you going to meet it? If you can share the data with us.
Well, again, like it's an unprecedented requirement, so there's no real data. Everybody's moving in the dark. So whatever numbers were, for example, a month back, and we would say that the mask manufacturing was more than sufficient for the country. But if every consumer starts thinking that he needs a mask, and there's a new supply chain that has been created, so a complete inventory which was not there earlier between a dealer and a pharmacy dealer and the pharmacy itself, and then the consumer itself, creating a demand which was not there before. That has completely spiked the requirements over there. So whatever surplus capacity was there in the country gets completed, and the lockdown has made it worse. Of course, we can't sleep. Most of us are having sleepless nights. We fully understand the responsibility for the country and for the manufacturers and to address this issue. We can only plead with the local officers that their job needs to now facilitate, and we have to recover the time loss. One thing has come out very interesting is that during our last week's review meeting with the Director General Health Services and his team, we came to know that seemingly the demand also is a little bit not fully understood, maybe by the medical profession also. So they expect that only the doctor and the medical practitioners or the healthcare workers who are directly going to be in touch with the patient who has actual infection, proven infection, needs to wear such kind of coveralls.
Right.
In case somebody is in isolation room or is in quarantine, then they don't think there is a need for the doctor to wear this complete overall with somebody who suspect. But they do expect that somebody who's going to be taking a swab and he's going to be taking swabs from a number of suspect patients in a row. Such handler would be needing to wear the PPE this thing. So that is a big clarity. We've thought that like the government took out a poster and a video that every consumer need not wear a mask. We've requested the government to come out with similar guidelines immediately so that the complete medical profession, who is now currently terrified all over the country, thinking that they are completely naked and unguarded against any such kind of infected patient, would be having some level of comfort that they can wear a secondary level of PPE, maybe which is not fully having the taping or the seams being covered, but it would still offer a considerable level of protection to them. And then that requirement would not be so much, I would say, enlarged as what the country is thinking it to be.
Do you think that the exports should have been banned much earlier? And I ask you this because we all saw the images of, I think, surgical gloves being exported to Serbia, and there was a lot of panic about why this export is still taking place and why the other exports were banned only on the 19th of March. Do you think we lost critical time in not stopping the exports earlier? And what is this export supply that has gone to Serbia at this critical juncture?
Well, let me explain to you the perspective. The government, in fact, before the government realized, we from manufacturing were realizing what's coming into the country as imports, where our capacity is limited, and where we will run short of stocks much faster because we don't have real manufacturing in the country, because India is more 80 to 90% import dependent on certain things, like, for example, N95 masks. There are only hardly 5 to 6 manufacturers for that. So the government had banned the N95 mask export really way back. But that time, they did not ban the export of the rest of the masks because there was a huge capacity that was available. And we did not think that the demand would spike so much that it will be affected as far as the other masks goes. As far as the PPE garments goes, the PPE garments were banned for export along with the N95 mask right in the beginning only.
When you say beginning, what is that date? Because we've all read that ban happened on the 19th of March.
No, I can send the date earlier to you. I don't remember it off my head right now. But it was way back. And in fact, the exporters were in fact crying that if the government is not clear about the specification, the government is not buying, then why are they stopping the export from manufacturers who've got these orders from USA and Europe? And I would say the same even right now, because if they cannot supply the tunics with the taped version, they felt that they should be allowed to sell outside. But we told the manufacturers that you must think India first and nation first. And definitely they do realize that responsibility. Regarding the gloves, what you just mentioned to me, in the case of gloves, India imports all the examination gloves from Malaysia. We don't make the non-sterile examination gloves at all in the country because the manufacturing cost in the country is too high, and it's cheaper for the manufacturers themselves to import the gloves from Malaysia. So over there, we had requested the government by ourselves that this is an import-dependent thing, so a ban can be put on that. But since sterile surgical gloves, India is a major manufacturer and a major exporter. Many countries depend upon India. And in February middle, we had seen that India has got about a spare capacity of about 786 million pieces of the sterile surgical glove variety. So we had sought that a ban may not be put on the sterile surgical gloves. But still, the government had gone ahead and kept the ban on the nitrile gloves because they said that these PPE kits mandate the use of nitrile gloves. They don't mandate the use of.
So these gloves that have gone to Serbia, sir, we don't have any shortage of.
We don't have any shortage of, and I would think that the whole world right now is reaching out to each other. So Mr. Modi, through his envoys, are trying to get specialist medical equipment and supplies from all over the world, like PPE, masks, ventilators, which cannot be produced so fast, and certainly in the country. And I think this is something which is part of international cooperation, where we are strong and where we can possibly help certain countries. And this glove consignment, which went to Serbia, was in that category of humanitarian aid. It was not a normal commercial shipment. It was an emergency shipment which the European Union and Serbia had sought from India. And this was not really going to be impacting the inventory in the country.
Okay. Now, I want to understand from you, what about the other devices? What about testing kits? Even on that, we saw a reasonable degree of confusion, because earlier they said FDA and EU certified, then they relaxed those norms, then one laboratory got it. Now, I'm not sure, is it 4 or is it more? What has been the biggest bottleneck for the medical devices production industry? Has it been the clarity on procurement? Has it been that the specifications have kept changing? What has it been?
Every product has got a different problem. So the kits have had another unique problem. First and foremost, a manufacturer, he has to validate his kit. To validate the kit, he needs access to the blood serum of an infected patient. Then only he can check the quality of his product. Now, this infected serum of the coronavirus is not being made available to the patients. They've been seeking this for quite some time. So without
to the manufacturers, you mean? You mean that you need the blood serum of an infected patient to validate your testing kit, and you have not had access to that?
Yes. So the manufacturers had initially given the samples without this kind of validation. Whatever they could validate based on other HIV or other serums, what they had, they tried to test as per that, and they had given it. So when the results came negative in terms of the quality of their product, in terms of the sensitivity of the test, they had to, of course, make a new batch, revalidate and come back. And that's where this bottleneck has been. Number one, of getting the serum. Number two, it became of having additional labs other than Pune. So we made a request to the government, and the government informed us 4 more laboratories where the manufacturers could go and get their product tested.
Right.
So if we get the go-ahead for the manufacturers, there are, of course, 6 or 8 in the queue, and then there are about 8 or 10 other manufacturers who do make certain products of similar nature for this kind of testing for other diseases, who are also in the queue, and they can immediately also ramp up capacity. They have automated lines to make the production fast. So the manufacturers are definitely from their side wanting to pitch in, wanting to give the country its best. But again, it requires a lot of coordination. So though a WhatsApp group has been created by the Department of Pharmaceuticals, we do seek that the Ministry of Health, the ICMR, and the other people on whom this dependency is would also be part of such kind of communication. But unfortunately, the Ministry of Health officers are heavily overloaded with other fires that they are trying to douse. And this is something which, of course, they need, but they need to get time for us for that.
It sounds like a very difficult situation. What's that one thing, if you had to identify the biggest bottleneck at the moment, what would it be, Mr. Nath?
For me, the biggest worry is, for which I have sleepless nights, is the PPE kits. If we cannot protect the doctors who protect us, it's shame on us.
Yeah. And how much time do you think you need to get everybody that basic PPE, not the high-end one that maybe only certain doctors need? Some people have suggested it could take as long as a month for the demand, for the demand to be met.
No, if we can make the PPE without the tape seams, for that, if the supply chain can be geared up on a war-like basis, if the army can make the product in the ordnance, the whole garment industry is right now idle. They're not making anything for exports. They've got thousands of these stitching machines, thousands of workers in so many large factories who can turn this around in really high speed. But it just needs a clarity to go ahead that this is the way we have to go forward.
Two great ideas you've made. One is using the army ordnance factories, and second, the garment textile factories. Have you discussed this with the government?
Yes, from our side, we have communicated to the government on a pretty much daily basis. I must say that the government has now changed its way of working. We don't talk about by letters or by emails anymore. Everything is by instant phone calls, by WhatsApp messages, by video conferencing. the way we work with the government in the last 1 week is a sea change. I hope it remains like this even afterwards.
Well, you have a really, really difficult task on your hand, and I really do see two constructive suggestions in what you've said, using the army ordnance factories and the garment textile factories, and I hope the government responds very quickly on this because we've already lost enough time. Mr. Rajiv Nath, good luck to you. We'll keep talking to you over the next few weeks, and thank you very much for talking to us.